we are starting late. I honestly believed we would be able to start at 4 p.m., but the discussions have been intense and have consequences, and therefore it was necessary to go through them with clarity. Fellow Kenyans, the coronavirus disease has continued to affect the world in an unprecedented way. Global statistics today indicate that there were 266,073 confirmed cases and 11,000 deaths. The epicenter of the virus has shifted from China to Europe. In Africa, confirmed cases as of March the 21st were 572, with 12 reported deaths. On Friday, we announced that there were no new coronavirus cases, and that the 7 patients who were tested positive for the virus were undergoing treatment and were stable. We continue to monitor their progress, as well as the individuals who have come in contact with them. And I may add here that they continue to be stable. In the last 72 hours, however, we have received confirmation of an additional 8 cases who have tested positive for coronavirus. This now brings the total number of those who have tested positive to 15. Out of the latest 8 cases, 5 are Kenyans and 3 are foreign nationals. The foreign nationals are 2 French people and 1 Mexican. All the 8 are imported cases from Europe and America. The ages are between the age of 20 for the youngest and 57 years for the oldest. All the 8 came through the Jomo Kenyatta International Airport between the 4th of March and the 17th of March. And they all have been isolated at various facilities and are being monitored by our teams. We are tracing 363 persons who had come into contact with these patients. So far, we have also an additional 3 people waiting processing at Bagathi Hospital. The rest have been processed and discharged. All the patients, except the one who is at the coast, at Msambweni, are all in stable condition. The government is organizing to having the patients in Msambweni airlifted to Nairobi for further treatment. As I mentioned on Friday last week, our actions continue to be guided by the trends that we have observed. That the number of infected persons increases dramatically in the second week following confirmation of the first case. I did further indicate that these coming 2 weeks are extremely critical for this country. as we seek to contain the outbreak. We remain focused on emphasizing high levels of hygiene and the maintaining of social distance as the most effective containment measures. This morning, when we were launching the CT scan center in the Jomo Kenyatta Hospital, you will recall, those of you who attended the conference center, the press conference, that throughout the discussions with doctors from many centers in China, the French doctors as well, the emphasis was on exactly the same thing: the levels of hygiene and social distancing as an effective measure. Fellow Kenyans, the government has, in the first few weeks, announced various measures that are aimed at containing this virus. However, much to our disappointment, we have noticed that majority of our people have continued to ignore these measures and are behaving as if it is business as usual. As I cautioned last week, this disease is not a joke. Kenyans must treat this matter with the seriousness it deserves by adjusting and changing their lifestyles. If we continue to behave normally, this disease will treat us abnormally.